This conference will now be recorded.
Okay, good afternoon. Today we'll discuss about hyperbaric oxygen therapy. First, a overview. We will be discussing first the definition, the history, the basic concepts behind this hyperbaric oxygen therapy, what are the indications, what are the contraindications and the details about it. Next, the complications and the applications. So what is the definition? Hyperbaric oxygen means intermittent administration of 100% oxygen at higher than the atmospheric pressure. That is, where oxygen dissolves in arterial blood plasma in increased amounts. Coming to the history, initially discovery in 1662, Henshaw built the first hyperbaric chamber. Later, Joseph Priestley in 1775, elemental oxygen was used. Oxygen was coined by Antony Lavoisier in 1777. In 1870, Fontaine and Berth used this hyperbaric oxygen for wounds. That is a surgical use. In 1889, Moir reduced mortality rate of decompression sickness from 25% to 1.6% per year using this hyperbaric oxygen therapy. This is the Steel Ball Hospital Timken Tank Cunningham Sanitarium. In this hyperbaric oxygen therapy was given. In 1926, six-story Steel Ball Hospital in Ohio, it has 72 rooms at pressure of 3 atmosphere absolute. In 1960, Boerema pioneered the application of hyperbaric oxygen to many medical problems. Performs first surgery with hyperbaric oxygen. Discovered that hemoglobin wasn't necessary for oxygen transport. Brumclamp discovered effects on anaerobes. That means if oxygen is given 100%, then it acts as a bacteriostatic. It can treat gas gangrene caused by Clostridium perfringens. In 60s, hyperbaric oxygen therapy went out of practice because it's used without adequate scientific validation. Over last 20 years, animal studies, clinical trials, and well-validated clinical efficacy has proved efficacy of hyperbaric oxygen in various ailments. Coming to the basics, you all know oxygen is carried by blood mainly in two ways. Most and majority is by hemoglobin, very less amounts by plasma. So normally the air which we inhale, it has 21% of oxygen at sea level pressure. Most tissue needs of oxygen are met from the oxygen combined to hemoglobin, which is 95% saturated. So 100 ml of blood carries 19 ml of oxygen combined with hemoglobin and 0.32 ml dissolved in plasma. And 1 gram of hemoglobin carries 1.34 ml of oxygen, whereas 15 grams carries 20 ml of oxygen. 15 grams of hemoglobin is normal hemoglobin for an adult male. So even if we increase this partial pressure of oxygen, hemoglobin can't carry more oxygen as it is already 100% saturated. Under barometric pressures, oxygen gets dissolved into plasma, and thus this dissolved plasma oxygen is carried to different tissues. So already the hemoglobin is 100% saturated. So if we give excess oxygen, then this excess oxygen will get dissolved in the plasma From this plasma, it is carried to the tissues. The higher pressure during hyperbaric oxygen treatment pushes more oxygen into the solution. Some laws, Dalton laws, increasing the proportion of oxygen in the inhaled gas mixture increases its partial pressure. Air at sea level is 21% oxygen. Hyperbaric oxygen treatments use FiO2 is 100%. You can see here, increasing the partial pressure of oxygen results in more oxygen dissolved in the blood. This is Henry's law. You can see here, initially in the lungs and the tissues, more oxygen is given. So the oxygen is getting dissolved and then it is carried to the tissues, causing perfusion to the tissues. And this is applied. This additional oxygen in solution is almost sufficient to meet the tissue needs without contribution from oxygen bound to hemoglobin and is responsible for most of the beneficial effects of this therapy. You can see here, in hyperbaric pressure levels, the venous oxygen levels, okay, it's very much more. So mechanisms, oxygenation of ischemic and hypoxic tissue. Hyperbaric oxygen therapy increases plasma and tissue oxygen tensions 10 times more, which helps the tissues to maintain tissue viability without RBCs. Next, neutrophil oxidative killing. Neutrophils regain ability to kill bacteria by generation of oxygen-dependent superoxides and peroxides. Suppression of multiplication in bacteria. High oxygen tension suppress the growth of streptococcus and anaerobes. We have already seen it's a bacteriostatic. Augmentation of antibiotic effectiveness. Increased oxygen tension allows oxygen-dependent active transport to bring in antibiotic across bacterial cell wall. Enhanced fibroblast function. This prevents unnecessary cicatrix formation. Angiogenesis means formation of new blood vessels. Increased oxygen tension increases vascular endothelial growth factors function as well as secretion of matrix by fibroblasts. Coming to indications. So in which cases you can use this? Gas bubble disease like air embolism, next decompression sickness, in case of poisonings by carbon monoxide, cyanide, carbon tetrachloride, hydrogen sulfide. Infections, clostridial myonecrosis, other soft tissue necrotizing infections, refractory chronic osteomyelitis, intracranial abscess, mucormycosis. Acute ischemia in cases of crush injury, compromised skin flaps, central retinal artery occlusion, central retinal vein occlusion. In chronic ischemic cases like radiation necrosis, ischemic ulcers including diabetic ulcers, acute hypoxia, exceptional blood loss anemia, support of oxygenation during therapeutic lung lavage. In dermal injuries like burns and envenomation, brown rescue spider bite. Coming to contraindications. One absolute contraindication is pneumothorax. Because already the lung is having more excess air. If you put the patient with more oxygen levels and more barometric pressure, the pneumothorax will be increased. It converts into tension pneumothorax. Another contraindications are drugs like alcohol, nicotine, cisplatinum, doxorubicin, bleomycin, aromatic hydrocarbons, disulfiram, steroids. Claustrophobia, history of spontaneous pneumothorax, COPD, seizure disorders, upper respiratory tract infections, hypothermia, malignant tumors, acidosis, history of thoracic surgeries, pregnancy, hereditary spherocytosis, optic neuritis, malignant tumors. Coming to the details of each one. How is it administered? Two types of hyperbaric chambers are present, monoplace and multiplace. Monoplace is where a single individual has a single chamber. Multiplace, many people will be present in the single chamber. This is the two-seater. Two people are present in the same chamber. Multiplace, where many people are present. This is also multiplace. Process of treatment. Initial compression for 30 minutes. Treatment for 90 minutes with air breaks. 10 minutes every 30 minutes is standard. Decompression for again 30 minutes. All regimens use 100% of oxygen. Pressure is mostly we use 2.4 atmosphere. Maximum the patient or the individual can tolerate is 3 atmosphere. More than 3, if 4 is attained, then it causes seizures. Complications. Mild problems like claustrophobia, especially in case of monoplace chambers, fatigue and headache. More serious complications, myopia that can last for weeks or months, sinus damage, ruptured middle ear due to more pressures, and lung damage. Major complications like oxygen toxicity can result in convulsions, fluid in the lungs, and even respiratory failure. You can see the lung barotrauma. Elevated pressures may damage the alveoli, leading to pneumothorax. Pulmonary interstitial emphysema also can occur. You can see this tension pneumothorax. Coming to the eyes, lens deformation causes temporary myopia. Progressive myopia has been reported in patients undergoing repetitive daily therapy, reversible within 6 weeks of discontinuing treatment. Oxygen toxicity. It is interesting that while oxygen is necessary for life in anaerobic organisms, it is also toxic. In 1878, Paul Bird, the father of pressure physiology, observed convulsions and death in animals at a constant 3 to 4 atmospheres of pressure. These are the symptoms with oxygen toxicity. Central nervous system includes seizures, eyes visual field loss, nearsightedness, cataract formation, bleeding, fibrosis. Muscular, you can see twitchings, respiratory, jerky breathing, irritation, coughing, pain, SOB, tracheobronchitis, and acute respiratory distress syndrome, ARDS. Bronchopulmonary dysplasia, retinopathy of prematurity can also occur. So where all will you use this hyperbaric oxygen therapy? Carbon monoxide poisoning. Carbon monoxide poisoning is the leading cause of injury and death by poisoning in the world. So affinity of carbon monoxide for hemoglobin is 200 times more than that of the oxygen. So in this case, supplemental of oxygen is the first line therapy. Hyperbaric oxygen causes carboxyhemoglobin dissociation to occur faster than pure oxygen at sea level pressures. Next is decompression sickness, also known as Casson's disease. Is attributed to formation of nitrogen bubbles in the body on decompression, occurs especially in divers, miners and astronauts. Divers resurfaces too quickly. Due to this, the nitrogen bubbles will be occluded. Gas bubbles form in the tissue and blood and it blocks the lymphatics, veins and arteries. So in these cases, you give this hyperbaric oxygen. This reduces the bubble size and corrects the hypoxia. Gas embolism. Air embolism is also caused by sudden decompression or ascent in diving, trauma like head and neck injuries, high altitude accidents, or may be iatrogenic during a diagnostic or surgical procedure. Air emboli may lodge distally in smaller arteries and arterioles of brain and obstruct the flow of blood, resulting in ischemia, hypoxia, and cerebral edema. The bubble may also act as a foreign body and start a number of chemical reactions. So in this case also, we'll give hyperbaric oxygen. So what does this do? Oxygen diffuses into the bubbles. It displaces the nitrogen from the bubble and it dissolves in it. So this induces vasoconstriction, inhibits air embolus redistribution, and decreases cerebral edema. High oxygen counteracts the ischemia and hypoxic effects of vascular obstruction. It also reduces blood sludging and improves WBC function. Coming to clostridial myonecrosis gas gangrene. Prompt recognition is important. Anaerobic bacteria are especially sensitive to increased tissue oxygen. Diffused oxygen, which raises capillary partial pressure of oxygen levels at the wound site, stimulates the capillary budding and granulation of new healthy tissue. High oxygen tensions inhibit the clostridial alpha toxin production, reversal of hypoxia-induced neutrophil function, enhanced macrophage interleukin 10 expression, and anti-inflammatory effects. It is also used in necrotizing fasciitis and Forney's gangrene, mucormycosis, anaerobes, streptococci infections. In chronic ulcers, usually chronic ulcers lack oxygen. Oxygen is required for angiogenesis, collagen deposition, reepithelialization, cellular respiration, and oxidative killing of bacteria. Decreased edema noted following hyperbaric treatment allows better diffusion of oxygen and nutrients through tissue while also relieving pressure on surrounding vessels and structures. In this slide, hyperbaric oxygen has been used for treating foot ulcers in patients with diabetes, venous and arterial insufficiencies, burn wounds, crush injuries, marginal flaps, and skin grafts. This is the wounds before and after using hyperbaric oxygen therapy. This is also another one, non-healing amputation stump. So wounds with diabetes. Foot wounds of patients with diabetes offer a particularly difficult problem. These patients often have an impaired immune system, predisposing them to infection. Blood supply to the wounds is hindered by large and small disease. The red blood cells are sticky and non-pliable, which leads to capillary occlusion and distal ischemia. Neuropathies render the foot insensate and impair motor function. This impaired motor function flattens the foot so that the metatarsal heads become prominent and promote further susceptibility to ulceration via pressure. Blood loss anemia. Intermittent hyperbaric therapy exposures have been used to relieve temporary physiological stress from acute anemia. This is rarely used for this purpose. May be useful when cross-matching incompatibilities and religious beliefs prevent blood transfusion. Coming to crush injury, hyperbaric oxygen therapy is used in limited degree for acute traumatic peripheral ischemia and suturing of severe limbs. This reduces infection and wound adhesions and improves the healing, improves oxygenation to hypoperfuse tissue, causes arterial hyperoxia, causing vasoconstriction and decreased edema formation. Also, intermittent pressure stimulates circulation and reduces edema. Early use of hyperbaric oxygen may reduce compartment pressures enough to avoid fasciotomies. This is also used in sport injuries, like trauma leads to physiological response leads to vasoconstriction, which leads to hypoxia. Ischemia also due to swellings, cutoff of oxygen circulation to the affected areas. So, increasing the oxygen, that is giving hyperbaric oxygen, this leads to increased collagen deposition or synthesis, increases angiogenesis or epithelialization, increases the recovery time. This speeds the recovery between the workouts. Coming to osteoradionecrosis, Damage to osteocytes from radiotherapy does not affect the necrotic bone. Target is the viable bone and soft tissue. So our goal is to revascularize this radiated tissue and to improve the fibroblastic density. Healing process requires oxygen for differentiation of fibroblasts, synthesis of collagen. So 20 dives before treatment and 10 dives after radiotherapy is given at 2.5 to 2.8 atmospheric pressure for 90 to 120 minutes. This is before and after treatment of with hyperbaric oxygen therapy, radiation necrosis. Coming to skin grafts and free flaps. Grafts or transplanted tissues may be healthy, but implanted site may be hypoxic. Due to tissue bed disease, vasospasm, edema, infection, oxygen, and nutrient supply is compromised. Must establish vascular connection for survival. So, this hyperbaric oxygen therapy mechanism improves tissue partial pressure of oxygen. This promotes angiogenesis, augments immune response, and limits inflammation. Coming to radiation sensitization, among first studied uses of hyperbaric oxygen in 1960s, hypoxia increases the resistance of cancer to radiotherapy. Increasing oxygen pressure in the tumor can aid the tumoricidal therapies. Increase the FiO2, increase ambient pressure, administration of radiation sensitizing agent. But still it is controversial. Data are conflicting. Handful of report cases suggest growth, promoting angiogenesis in tumor cells. Other reports suggest tumor suppression. So it is still controversial whether we can use HPO in these cases. Gamovax, a rescue product for high altitude climbers and trekkers, is used for the treatment of moderate to extreme altitude sickness. By increasing air pressure around the patient, the bag stimulates descents as much as 7,000 feet. So various regimens where you use in the various cases. 2 atmospheres for 90 minutes is used in wound healing, compressed skin grafts, thermal burns, osteomyelitis, crush injury, or compartment syndrome. 2.5 atmosphere oxygen for 90 minutes is used in non-clostridial gas gangrene, necrotizing infections, osteomyelitis, radiation tissue injury. 3 atmospheres for 90 minutes is used in carbon monoxide poisoning, clostridial gas gangrene. So we can use hyperbaric oxygen effectively in cases of air embolism, decompression sickness, carbon monoxide poisoning, radiation necrosis, chronic ulcers. Thank you.